With other oral appliances, let's say a Herbst or a dorsal or a mite or a tap, whatever oral appliance you look at, they typically attach to the upper and lower teeth and use the upper teeth as leverage to bring the mandible forward to open up the airway, right? That's where you get the long-term side effects, which can even be short-term. It can happen in a few months. Permanent tooth movement, bite change, and severe joint pain because of how they unnaturally anchor the mandible forward using the teeth as leverage, which is what we know now as headgear effect, right?
Mm-hmm.
We now know that oral appliances have a similar effect on the upper as headgear, which can retract over years of use. So what's unique
Wow.
with ApnoMed and ApnoDent, if we're looking at just our sleep appliances, not our expanders, is that we do not anchor on the upper teeth to bring the mandible forward. We kind of utilize the body's mechanosensory activation, which is a tactile response. And any of your customers or viewers who have used an ApnoDent, they're going to understand what I'm saying. But there's just a bar on the lower part of the appliance that adjusts forward. When the lower teeth touch that bar, it's really telling the brain that, hey, your mandible can't go farther back. Let's actually, on our own, muscular force, hold it forward and bite down on the appliance. If you look at it functionally, it really acts like a TMJ splint because you can adjust the occlusion of the appliance, whereas you can't do that with other oral appliances. So it means the bite, if you have an unstable bite and then you shove an appliance in that patient's mouth, it's just going to make it worse because you're yanking their mandible forward and they're still biting down on a non-perfect occlusal surface. Whereas with the ApnoDent, when the clinician delivers it chairside, right? I don't know if you've ever gone through getting a splint or a night guard, but they have you buy
Never.
wax paper and then they shave off the acrylic to make sure that your bite is perfectly symmetric so that the joint is biting down evenly and it's safe on the joint. So that's how a night guard works. So let's say if you have a bite discrepancy and you're touching on one tooth or not touching on others and your jaw is in a lot of pain, they'll give you a kind of a splint that they adjust the occlusion of the splint so that the bite is perfectly even. And that's how they pretty much resolve the pain and get the TMJ under control.
Mm-hmm. Mm-hmm. Can you say a little bit more about how that bar works to give the body that biofeedback to tell it to hold the jaw forward, or are we entering into like privacy
No,
terrain
absolutely
there?
not. No. So it's pretty much what we call it is a mechanosensory activation, which is it's really a tactile response. I think the best analogy that my dad likes to use that really makes sense is a horse. When you go horseback riding, right? You've got 1,000-pound animal. You're not grabbing this horse by the freaking head and turning it, right? No matter how strong you are, it's just not going to work out. The way that you control that animal is the horse bites down on a bit, right? And then it's got reins attached to that bit. Just the slightest touch of that rein, you're controlling that animal to do whatever you want it to do. And guess where that bit is contacting is on the teeth, which is one of the most sensitive tactile response we have in the human body. So it's the same concept in our oral appliances. So that bar, when it touches the lower dentition, which is the most sensitive teeth that we have, that signals to the brain to let's keep the mandible forward in that forward resting posture, bite down on the appliance, bring the tongue to the top of the appliance to promote a proper tongue resting posture. So we're not really, if you look at like an Emma or a dorsal, they pretty much will like jackknife you into that forward stuck position, which is what's causing that pain and side effects over years of use. Now, I'm not saying every person on an oral device will get side effects. That's just not true. There's many good providers out there that can manage a patient long term if they're very careful and precise and don't over advance on any appliance out there with minimal to no side effects. But there is typically some side effect if you're talking about prolonged use. It's just basic mechanics, right? It's leverage based. So if you look at a tooth-borne leverage based appliance that's anchoring on the upper teeth to bring this forward. You're pushing on this to pull this forward. It's just a matter of time before teeth start to move.
Yeah, Newton's third law.
Yes,
Yeah.
exactly.
And so your ApnoMed appliance, see, I generally frame splints as a Band-Aid, in that the better thing for a patient to do is to get the permanent fix via
100%.
expansion and corrective orthodontics.
Yes.
But that's just not going to happen because there's a dearth of practitioners that are even capable of executing the expansion.
Yeah, the ApnoDent, any oral appliance is a Band-Aid solution like a CPAP, right? But that's kind of where the ApnoTX comes in, which I think you kind of there was a misunderstanding with I think one of your people on the podcast. They didn't understand what was the difference. So the ApnoTX is a variation of the ApnoDent that can actually be used like on active orthodontic treatment. It is not meant to do any type of expansion at all. It's not a removable expander, but what it does do is actually follow the moving teeth. When you go down an MSC or any ortho treatment, it is freaking uncomfortable. Shit's moving, especially if you're putting TADs in, you're expanding, it can hurt. So they'll be on the ApnoTX for 2, 3, 4 months, depending on the severity, get the joint under control that it's not hurting. Then he'll introduce the expander, right? And then once the expansion's done, he'll put him on aligners. But through the whole time, they're wearing the ApnoTX because it gives them what? It's nighttime relief. I would say ApnoTX and the ASA aligner sleep appliance are really the only two appliances out there that can be on a used as a like you coined it, go with the flow appliance. The ASA, you cannot adjust the occlusion of it, so it's not really used for TMJ patients. That's kind of where the ApnoTX comes in.
Even the ApnoMed can adjust for the occlusion, right? That's kind
Yes,
of what
the
makes it
base one.
special.
Yes, the base ApnoDent, it will act as a TMJ splint. It's just not a go with the flow appliance.
And because there's no headgear effect, can a
Yes.
patient wear an ApnoMed for years and
Years.
just
I
kind of?
think my dad has been wearing his for damn near over a decade now, and we have patients that are close to the 10-year mark, like way before we commercialized it, because he's been using. I think the earliest variation of the appliance that he used in his practice is like over 10 years old. That patients were using it as a splint, not an oral appliance for sleep apnea, but it was the same general concept. And I mean, no bite change. So they can continue to wear it as a long term management appliance with no problems.